For me, it's my eyesight that's the biggest challenge, and that's what I want. I don't care about anything else. I'll deal with the head pain. I just want to be able to drive, and I want to be able to read.
So IH stands for Idiopathic Intracranial Hypertension. It's a disease where you have very high pressure in your head, and often we don't know why. High pressure in the head, essentially, and it squashes the brain, and it especially affects the eyes and causes blindness.
I began losing my sight pretty quickly, and it was my peripherals at first, and then my long distance sight. I began wearing glasses for the first time in my life. I started medication pretty quickly afterwards, and that made me really, really unwell, as if waking up with the worst hangover you've ever had. Made me feel so nauseous that I would vomit every day. I would wake up feeling absolutely atrocious, and it unfortunately wasn't doing enough to save my sight. I have had 5 brain surgeries and 1 spinal surgery in the past 12 months, where I've spent 12 weeks in hospital all up. And my pressure and my pain is something that I am still managing every single day. I am extremely lucky because I have more good days than bad, but it has been a really long and hard journey to get here, and 1 brain surgery is too many. And I know that I'm not done, because best case scenario, you have to have a maintenance on your shunt every 20 years. And that's best case scenario. And with my luck, that is probably not going to be the case. I find when I do get pressure, it's just the worst extra symptom is the nausea. So when I have bad days, it just completely knocks me out. Yeah. But I'm aware that the reason that we had the surgery is to fix my eyesight, and I can see perfectly fine.
That's good.
So,
that's good. Yeah. And it does sound a bit mucus. If you're getting that sort of nausea with it as well, I think it probably is a post-surgical thing. I think you probably, because a lot of people find with an IH problem have quite migrainous type symptoms.
Yeah, I don't think I ever had headaches before, and it is just like the pressure in the front of my head.
Yeah, okay.
And also it's the eye.
The eye. The eye's a good indicator, I must say. Bad headaches, and usually headaches with pressure are worse in the morning and often associated with nausea and vomiting first thing in the morning, or can wake you overnight. Blurring of vision is very common, and that's of course very sinister because somebody can then, it's heralding that they're losing their eyesight. Often people get funny noises in their ears, so they're called visual and auditory obscurations, so things just get a bit dulled and fluffy, or you might have tinnitus, like ringing in your ear, and they're the main symptoms. So it's not a common disease, and it's one of the reasons why it's hard to diagnose. People don't see it often. I think because it's hard to diagnose, people will often put headaches down to just headaches, and headaches are really common. You know, the difficulty for doctors is that you come with a common condition that has an uncommon cause. It can be quite a difficult disease.
I thought I'll take some tablets and I'll be okay and life will just continue. The reality is that 22 weeks ago I haven't been the same. It's just gotten worse. Ended up having a shunt, 2 revisions, 11 surgeries later, and I'm still here. You wonder if things are going to be the same. Like, I don't think they ever will be the same. I don't think they can be the same, because now you've got shunts inside of you that you need to protect so that you can just live and not have, crazy mad head pain, or just so you can get through from one day to the next without head pain or without ear buzzing, or just so you can get up and get from one room to the next.
Unfortunately, because we don't understand the underlying mechanism, means we have to resort to treating the things that we can see, which necessarily means treatment is going to be limited because we're not fixing the initial problem. You can take fluid away from the head, so you can shunt somebody, and if you don't want to shunt someone, you can try tablets like Diamox. The biggest problem with medicine is that there's nothing that will actually stop you making fluid in your head, and we make half a litre a day. So medication can only take that down to about 300 mils a day at the most. So you're still making too much fluid for your head. You've still got to absorb it, and you've still got to absorb it under pressure. So the simple medical things like tablets just don't cut it, unfortunately.
It is this hidden illness or disability because I just thought it would go away, and I think I still haven't come to terms with it. I still think, oh, it might go away. I'm going to be one of those people where they talk about it goes into remission.
There is remission, but that means different things for different people. For some, it's being able to see enough to be able to drive. For me, it means being able to work. And then there are others who are just looking for a pain-free day to be able to get their housework done.